Just about everyone in this room probably has experienced an ankle sprain, but did you know the proper way of taking care of it afterwards? It's as simple as the word RICE, but I'll talk more about that later on. The American Academy of Orthopedic Surgeons defines sprain as the simple process of twisting and sometimes tearing the ligaments in your body. Unfortunately, the aftermath is not that simple. Most ankle sprains happen after a sudden shifting movement of the foot and ankle and can be incredibly painful. It happens to adults and children alike, and while it happens to athletes often, a person can suffer an ankle sprain just by taking one misstep. According to the American College of Sports Medicine, it's estimated that 25,000 Americans suffer from an ankle sprain each day. Some studies suggest that nearly half of those ankle sprains are misdiagnosed. That's why it's important to know the RICE method. As a former high school athlete, I know all too well the pain associated with a sprain. And as a registered nurse today, I often consult patients on proper treatment, including that of sprains and strains. This afternoon, I intend to share with you the importance of knowing the proper treatment of potential ankle sprains using the RICE method. Before I share with you the steps of the RICE procedure, I'd like to talk to you a little bit about sprains in general. The Academy of Orthopedic Surgeons state that sprains, particularly those felt in the ankle, are graded based on the severity of the sprain and the damage done to the tendons and ligaments. A grade 1 sprain is the least severe and includes slight stretching and minimal damage to the fibers of the ligaments. When a grade 2 sprain occurs, the patient has substantial damage and partial tearing of the ligament. The most severe form of sprain is a grade 3, and that happens when a complete tear of the ligament has occurred. So you're playing football, dancing, running, when an awkward step makes you quickly realize something's wrong. What do? Rest, ice, compression, elevation. RICE. Rest doesn't necessarily mean sleeping. It just means sitting down and staying away from physical activity for a little bit. Ice, according to Dr. Sherwin Ho, professor of surgery at the University of Chicago Medical Center, 20 minutes of ice at home is ideal. Use a bag of frozen vegetables or an ice pack and apply it about every 3 to 4 hours as needed for pain. C stands for compression. An ACE bandage wrapped snugly will provide just the right amount of pressure to the affected area to help decrease swelling. Elevation is the final step of the RICE process. For an injured ankle, lie on a couch or on your bed and elevate your ankle above your heart. This will alleviate throbbing or unintended swelling. The American Academy of Orthopedic Surgeons recommends staying off your feet for about 2 days to allow adequate healing. Sometimes a 5th step is required in the RICE method, and that's medication. If you find the pain is just too intolerable, an over-the-counter anti-inflammatory medicine like Aleve or Advil will help. So it doesn't matter whether you're young or old, overly active or not, a sprain is a common injury suffered by tens of thousands each day. If you're one of those suffering, think RICE. Rest, ice, compression, elevation. And you may be able to speed the healing process so you're back on your feet literally in no time. Thank you.